70% of adults experience at least one traumatic event in their lifetime. 1/5 of those people will develop post-traumatic stress disorder. So what causes PTSD? How do you spot it, and how does one live with it? In this episode of Being Well, I pose all these questions to Psychiatric Nurse Practitioner Zach Backlin.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
Thank you for joining us for this episode of Being Well. I'm your host, Lacey Spence, and today we are welcoming back a guest to the show. We haven't seen him in a couple of years. We're welcoming in Zach Backlin. Thank you for coming back to Being Well. I sure appreciate it.
Oh, thanks for having me.
Of course. And so you've had a little bit of transition in where you're serving these days. So can you please fill us in where you're at and what you're doing?
Yeah, so I, about a few months ago, opened up an office down in Greenup, right on Main Street there. And right now I do psychiatric medication management, psychotherapy, and substance use treatment.
Wonderful. So that is right in the alley of what our topic is today, which is PTSD. So I think just as a groundwork to kind of lay everything out, first off, what is PTSD? What's it stand for?
So PTSD is the acronym that stands for post-traumatic stress disorder. Most commonly occurs in someone who's experienced a traumatic event psychologically or physically. We traditionally associate it with veterans coming back from war, but in the past few years with the struggles we've had with the pandemic, there are a lot more people who are not necessarily soldiers or police officers who are coming and they're struggling with these same symptoms of PTSD.
Yeah, and I mean, in addition to that, besides, I mean, obviously the pandemic has been a huge equalizer and we've all gone through so much. In addition to military service, the pandemic, what other causes could there be of PTSD?
Oftentimes you see a lot of history of abuse or neglect as a child or as an adult. People who are survivors of domestic violence also tend to have PTSD. We tend to think of it as this aspect of everyone is experiencing terrible things, but there are people who experience, traumatic events secondarily. So like someone who has to care for somebody who has experienced a traumatic event and is reliving and re-experiencing that event with them can also develop symptoms of PTSD.
Gotcha. So are you talking like maybe if I have a loved one who has cancer and I have to watch them walk through that can be very traumatic for me?
Absolutely.
And so does it have to just be an event? Can it be over a period of time? Mm-hmm. Does it present differently for different people?
Absolutely. In terms of periods of time, if someone is living in a terrible situation or, maybe they've suddenly lost their job, they no longer have the money, the resources to take care of themselves or their family, anything that really causes a major life event, whether it be ongoing or intermittent or just one specific time, it can cause these traumatic symptoms.
Yeah, and so let's talk about that. So how does PTSD affect someone's mental and emotional well-being?
So the most common thing I see with PTSD people is they are constantly reliving and re-experiencing the traumatic event that happened to them. So they almost kind of become stuck in time in that they can't move past this terrible thing that has happened or this terrible thing they've watched someone else go through. And so essentially it causes things like sleep disturbances, It can cause depression and anxiety associated with the event. One of the things also I treat very frequently in people with PTSD is nightmares. Very vivid experiencing nightmares, usually revolving around the traumatic event they experienced. And they get stuck in the moment and they can't move past that thing that happened to them.
That's what I wanted to ask. You're the teacher here in this. So can people also experience like flashbacks too when you're saying it's so real? Absolutely.
Re-experiencing or reliving the event over and over again in their mind. That was kind of where we first started seeing it. When we talk about people who are like, veterans coming back from wartime, they've experienced all these terrible things and they don't come back from the combat situation because they're constantly just feeling like they're there.
Mm-hmm. And you're talking about some of the symptoms. What other common symptoms are there of PTSD?
One of the big ones I would say would be heightened alertness. Things that I see most frequently is a lot of people who had experienced trauma in their past and never gotten help for it or never recognized it as trauma, oftentimes mimic the symptoms of having attention deficit hyperactivity disorder, in that they're constantly on alert for danger because they're worried about what's the next thing that's going to happen to me, or they're re-experiencing what's happened. So they'll come to me and they'll say, yeah, I went to my primary, or I went to the urgent care and they said this is ADHD. And I'll be like, okay, well, let's dig a little deeper. When did this develop? Did this suddenly start happening around the time you experienced something terrible? Or is this something that you've had in childhood? Or is this, we got to tease out whether or not it's really an attention problem or it's a hypervigilance, constantly on alert for danger problem, because those two can mimic each other very, very easily.
And for a second, let's step back and talk about what you do. You and I were talking before we started recording that part of your services include helping people walk backward from drug addiction, assisted medication, those types of things. But you also offer therapeutic services. For someone who's never been to a therapy session, what can they expect, especially if they're trying to tease out or think that they might have PTSD?
So usually what I'll do is you start at the beginning. I take a thorough history of, have they had treatment before for depression, anxiety?
Yeah.
Do they have a family history of depression, anxiety, things like that? And then I kind of take their life from the beginning and walk them through where they were then and where they are now. And I'm really just trying to get a grasp of what's bothering them. Is it something like a depression or an anxiety by itself, or is it all of these symptoms that are stemming from a traumatic event that happened in their past that they just can't get around or get past?
Mm-hmm. And as you're talking about ADHD being something that can be a signal to PTSD, those other conditions, anxiety, depression, those can also be not masked as, but can also be part of PTSD. Are there any other conditions that maybe present as one thing but can really be tied to this?
Sleep disorders, insomnia, things like that. People who have difficulty getting to sleep, staying asleep, waking up frequently through the night. It's a matter of, is this an organic biologic thing going on, or is it that they're experiencing nightmares or reliving their traumatic experience at night and they can't just turn their brains off?
Yeah. Well, and the last time that you were here, we were talking about breaking down a stigma. And so I feel like we're kind of doing that again. How important is it to reach out and talk to somebody, to not be afraid to let someone know that you're having these feelings?
It's very important. Routinely, as people, we oftentimes confide in friends and family, and we talk about things that have bothered us. But on some level, it's you're kind of just spreading it around. Talking to a professional can give you the objectivity you need to help you work through the traumatic event. Whereas, it's great to get things off our shoulders and tell our friends and family these things, but more often than not, they're not equipped to be able to handle people process what happened to them. Yeah. So making sure that you talk to a professional is very important.
Yeah, when Aunt Jean has an opinion about everything, and it's like, that's not what I need right now. And so you've kind of talked about it, these things can happen in childhood or in adulthood, but can we see PTSD develop earlier in those children who have experienced something traumatic?
Absolutely. And oftentimes, unfortunately, you'll find it in children that are in the foster care or the adoption system. You know, they've simply the act of being taken from their birth parents is a traumatic event in itself. Whether or not it was appropriate or not, you're still taking, you know, a child away from a parent that they've grown attached to, that they've developed those nurturing bonds with, and disrupting that in itself can definitely create traumatic events.
Are there other instances?
Children who are abused or neglected, you know, not necessarily removed from the home or even knowing about it, but, you know, we also see a lot of sexual abuse when it comes to young children, children who are molested or, you know, sexually abused by adults or other children. That's a traumatic event in itself.
Oh, of course. So does it present differently in children, or does it look similar to how it does in adults?
It can vary. The big difference with children is that, you know, as adults, we've got the benefit of experience and life experiences. So I wouldn't say that necessarily makes it easier, but, you know, having the ability to rationalize on some level what's been going on is an advantage that oftentimes children don't have. So they can do things like act out, they can be aggressive towards other children, you know, they can isolate themselves, they can start having behavior problems, and then we, you know, loop back into the, is this traumatic or is this ADHD? Because again, these children, they can't sit still, they're constantly on the lookout for danger, they can't focus on their schoolwork, they can't focus on, you know, just being a kid and growing up in a loving, nurturing environment.
And either way, whether it is ADHD or PTSD, I mean, medication is an option, but making sure that you're going about the right channel, I guess, must be important too.
Oh, absolutely. I mean, the first line treatment for ADHD is usually stimulants or some non-stimulant, you know, drug that causes them to kind of be able to focus and concentrate on what they're doing. But if you give a stimulant to a person who doesn't actually have ADHD, you're going to make their hypervigilance worse, you're going to make their sleep problems worse, you're not, you know, they're not getting the appropriate treatment.
And that is obviously not the route you want to be going. So how does PTSD affect a person's ability to function in daily life?
So when it comes to that, their interpersonal relationships are damaged. You know, it is very difficult to learn how to trust after you've been burned or hurt. And when you have something these people have experienced to that level, you know, it affects their ability to develop loving, connecting relationships with other people because, again, someone or something has hurt them in the past, so now they're, you know, not wanting to open up to be able to make those connections with other people. You know, as human beings, we're social creatures, but when you introduce something like this into the mix, you make it very difficult for people to trust.
Right, yeah, we're supposed to be in community, and so then that just, it tears everything down before a lot of relationships maybe can even start too. You talk about the isolation. Do you have a lot of patients that come in who have self-isolated and want to kind of get to the root of that?
Oh yeah. Social anxiety, generalized anxiety are definitely associated with PTSD. I mean, you know, you're putting these people in situations where they've experienced negative consequences, whether it's their actions or not, and you're expecting them to have a different outcome without the help to be able to process what they've been through.
So once someone has come in to see you, you've pinpointed that you are living with PTSD. What's next? What does treatment and living with this look like?
Treatment usually involves being specific to the patient. You know, a lot of times we'll try to treat the underlying symptoms, whether it be a depression associated with it or an anxiety issue associated with it. But there's also the gold standard for people with trauma, and that's the EMDR therapy treatment, eye movement desensitization reprocessing, which actually allows them to pull up the traumatic memory they're experiencing and distracts their brain while they're trying to re-experience that memory so that they can process it and put it back into long-term memory where it's not constantly at the forefront of their conscious mind.
Wow, so this is the first I'm hearing of EMDR. What does it look like? Is there like a device that helps them? Usually
there is a device. It involves basically they're looking into at an image or something that's non-traumatic, but they're trying to call up the traumatic memory they're experiencing. And while they're doing that, the image is causing them to try to move their eyes rapidly. So they're focusing more on the motion that they're creating with their eyes, and it enables them to start helping them to move past the trauma by processing it in a different way that doesn't bring up all these negative emotions and experiences.
Wow. So how successful have you seen this be maybe in your practice?
I don't do it personally, but
Okay.
I've seen it pretty successfully done in other places. I know I work with a couple of groups where they have therapists who specialize in that form of therapy, and they've had really good success with it.
Interesting. So other than that route of treatment, are there any other routes of treatment you'd like to talk about?
I do talk therapy, cognitive behavioral therapy, dialectical behavioral therapy, all of the different types of therapies that help people to recognize what's going on so that they can help process and move past it, because that's really the key. We're trying to get people back to a level of functioning where they can get back and have those relationships with other people and get back to society and be functioning. You know, ultimately, a lot of what I do in terms of treatment is the goal is a return to function.
Yeah.
You know, I want them to be able to feel like they can be contributing members of society again, because they've become so pulled back and isolated and distanced from everything that they used to experience that would bring them joy and happiness. And without that, they can't function.
Yeah, well, and I think one of the key things that someone should maybe take away if they're watching this episode is that living with this is possible, and being able to cope and to talk about it is all, you know, it's a good thing. It's a good way to process it. Do you have people who come in who maybe have been discouraged from seeking treatment? Absolutely.
You know, and the biggest thing is that they're just afraid of what I'm going to do or what's going to happen with the treatment. You know, if they've never engaged in it before, they don't know what to expect. And, you know, it circles back to they're already leery about engaging in things they're not familiar with because they're constantly looking for danger. So being able to make that connection with them, that therapeutic connection, and tell them that, you know, this is a safe place for you to be, and we can work on this, and I'm not going to push you past your boundaries, but we're just going to try to piece by piece get you back to a normal level of functioning.
And so let's kind of go around that as well. So if I'm somebody at home who is living with PTSD, are there any self-help techniques that I can maybe take on myself?
A good one that I find pretty good success with is blocked breathing. And that's if they're experiencing a re-experiencing episode, or they're experiencing nightmares and they're trying to calm themselves down. And it basically just involves 3 sets of 4 seconds where you breathe in for 4 seconds, you hold your breath for 4 seconds, and then you breathe out for 4 seconds. And you can repeat that as much as you need to. And it helps kind of focus on your breathing so you're not being pulled away from what you're experiencing.
Interesting. So that is, the resetting your breathing really is such a big one. For some folks who are having the panic attacks when it's just like I can't catch my breath, the heart racing type of thing like you're describing. Other than that, is there anything else people can try at home?
I find a lot of people who want to try meditation at home, but they have difficulty because it's kind of a nebulous thing. People don't really understand how to, meditate or what it involves. And so I'll usually tell them that, if you're trying to focus your thoughts into a calming situation, putting something in your hand, whether it be like a pencil or a pen or a rock or just something, and just focusing on how that feels in your hand as you slowly breathe in and out. You're bringing your attention down to something that's in the present and helping them from being pulled back into the past.
Yeah. I feel like I've also heard of like grounding yourself, like if you can get barefoot on the carpet or barefoot on the grass, doing the same thing, just having that texture gives you something else to focus on, per se. So PTSD, can it occur like long after someone has experienced the traumatic event? Does it happen immediately? Is it different for everyone?
So PTSD by definition is 6 months or more after the event itself.
Okay.
Anything less than that we call an acute stress response. And that's where it's still within that stage that they're still really close to what happened to them. And there is still a chance in that acute stress response that they could process what happened and move on and move forward. But when they don't after that 6 month period, that's when it's classified as PTSD, because it's now
post.
Yep. They're no longer, right after what happened. They're now still on it 6 months, a year, 2 years, 10 years later, and they're still fixated on what happened to them, and they can't process it.
Well, and I think as far as processing it, I know we've talked about how talking to somebody, talking to a professional, to a lesser level, talking to our family, but how important is it to have a good supportive system around you?
It's very important. And I think that's part of the resilience aspect of it. If you do have a support system around you when you go through these traumas, you're less likely to develop PTSD because you have a support system that's able to support you and help carry the load when you can't, give you the time you need and the space that you need to be able to process what happened to you. Whereas if you don't have a support system of friends and family around you, you're more likely to have this prolong because you don't have an outlet for it. You don't have a way of working through it.
Yeah, well, and so then I have to ask, people who maybe are inflicted with cancer, they want a cure. PTSD, is it something that can be cured? Can you ever be PTSD free?
It goes into remission with appropriate treatment and time. I mean, every person is different, but I'm of the theory that you get out of things what you put into them. And most people that I see with PTSD want to get through it. They want to get past it. They don't want to live with it constantly hanging over their heads every day. And so they'll put forth the effort because they're trying to get through it. It's just a matter of helping them with what they need and empowering them to be able to help themselves.
Sure. So if somebody who has suffered from PTSD, say they're in remission or they're receiving treatment, they're doing better, can new traumatic events bring up old traumatic events?
Absolutely, they can. And that, makes it more complex and more compounds the problem because now you've gotten them to a point that they've started to trust again. They've started to be able to be present in the moment again. And then you hit them with this second, baseball that just comes flying out of left field. And it makes the treatment that much more complex because now they have a second trauma compounding the first one.
And so then, again, so much more important to make sure that they're seeing a professional, seeking help so that they can process everything. In our last couple of minutes here, is there anything about the topic of PTSD that we've not covered that you think would be vital for a viewer to know?
I would say the major thing that it's not permanent, like you asked earlier. It's something that can be worked through. And, I've yet to find a patient that is truly unfixable. It's just a matter of finding the right mix of things to be able to help them with what they need. Meeting them where they're at is important. And nobody is beyond help.
Well, and oftentimes people will get in their own way. That negative self-talk, that I'm broken, I can't be fixed, yada yada, and that negativity is not, it's not going to help you heal, but always having an objective sounding board to kind of negate those lies that you're telling yourself is so important. Are there any stories that you might be able to share, obviously not in depth, but of a patient or two that you've been able to help them walk through PTSD?
I mean, a lot of it, the ones that I've seen have worked through it, has been revolving around substance use, unfortunately. Whatever it is that caused them to start using whatever substance they're at, helping them recognize that, these are two separate problems, but they're interrelated. And so if we can work through the event that caused, like if somebody was abused as a child, and then they fell into starting to use substances because they're trying to cope with what happened to them. And helping them with both of those problems so that they can, stop using whatever it is that they're using and work through what has caused them to fall into that in the first place. I've seen quite a few of those cases where once you get the whole aspect of it together, you help them with both problems.
Yeah. Have you as a professional ever had to collaborate with other professionals because someone's case is so complex?
Oftentimes therapists are really good sounding boards. Part of my training involved therapy, part of it involved medication management, but when you come to working with therapists and social workers, all of what they do is therapy. So they've got a lot more experience with it, and they've got a lot more training, formal training around it. So being able to kind of bounce suggestions or ideas off of them has been really helpful.
Yeah. In our last minute or so, I have to ask, I'm sure it's a rewarding experience for you to be able to help people walk through this. Can you talk about that a little bit?
I mean, yeah. Helping people has really been something I've done since the beginning of my career, back when I started as a registered nurse. I mean, And to be able to see the end outcome and the result of being able to help people achieve their best selves is very rewarding.
Yeah. Well, and one more time, just before we wrap up here, where can folks find you now?
So I am down in Greenup, right on Cumberland Street, right there on the main stretch. I am next door to the Legion and across the street from the bar.
And it's called?
Noble Health Associates.
Noble Health Associates. Awesome. Well, Zach, you've been a wealth of information again. Thank you for coming back on Being Well. I appreciate it.
Thank you for having me.
Of course. And we, of course, thank our viewers for joining us for this episode. We hope this information was impactful. And if you know someone who is suffering from this, please share this episode with them. And we hope to see our viewers next time for our next episode of Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl, with Health Alliance, is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
When Sarah Bush Lincoln opened in 1977, it was with the promise to serve the community's healthcare needs. It has grown into a 2-hospital system with nearly 60 clinics that provide trusted, compassionate care.